Welcome to the Health, Balance, and Wellness channel, your oasis of peace. Do you often feel heavy legs, swollen feet, tingling, or nighttime cramps? You're not alone. Many people experience these types of problems, especially when blood circulation isn't working properly. Poor blood flow can affect the entire body, but the first signs often appear in the lower limbs. The legs, in fact, are the part of the body most affected by poor circulation. Varicose veins are among the most common warning signs, but the most serious problem isn't so much the aesthetic aspect, but the fact that poor circulation can pose much more serious risks. It's important to understand the symptoms of a circulatory disorder so you can intervene promptly, and at the same time, know which nutrients can promote healthy blood vessels. Certain vitamins play a crucial role in keeping blood fluid, strengthening vascular walls, and preventing long-term damage. Before exploring these vitamins, it's important to understand the signals the body sends us when circulation is out of balance. Before we move on, I'd like to ask you to support our work. But let's get back to the video. The 5 main symptoms of poor circulation. The first symptom to consider is pain that occurs while walking or after maintaining the same position for a prolonged period. If, for example, you start to feel the same discomfort after about 10 minutes of walking, it's possible there's a blood flow problem. In some cases, this condition can be confused with nerve inflammation in the back, but more often it directly affects the blood vessels. If left untreated, this condition can progress to peripheral neuropathy. A characteristic sign of this worsening is hair loss in specific areas of the leg. In any case, if the symptoms recur, it's always advisable to see a doctor. The second symptom concerns the temperature of your feet. When they are consistently cold, even in summer or in warm environments, it could be a sign of atherosclerosis or venous insufficiency. This condition is more common in women, people with thyroid dysfunction, or the elderly. For those who live alone and neglect daily foot care, the situation can worsen because any injuries or small cuts may go unnoticed in time. The third sign is calf cramps during exercise. If you experience pain or sudden contractions even after walking short distances, it could be intermittent claudication, a condition that occurs when the arteries in the lower limbs are partially blocked and unable to provide sufficient blood flow to the muscles. The fourth symptom is changes in skin color. Obvious changes, such as paleness, purplish patches, or dark spots on the ankles and feet, are often linked to blood pooling. This can cause small clots that alter the skin's appearance, making it uneven and lined. For this reason, it's helpful to carefully examine the skin of the lower limbs, including the calves and heels. The fifth symptom is the appearance of very visible varicose veins or superficial spider veins. Although they are often considered merely a cosmetic problem, they are actually indicators of poor venous circulation. They can cause swelling and pain, especially worsening with prolonged standing or during the hottest periods of the year. If left untreated, these conditions can degenerate into serious complications such as thrombophlebitis or skin ulcers. If you experience even 1 or 2 of these symptoms, it's a good idea to consult your doctor or an angiology specialist. Only a thorough examination can distinguish a simple, temporary ailment from a condition requiring targeted treatment. The 4 essential vitamins for circulation. After reviewing the warning signs, let's move on to the substances that can help maintain healthy blood vessels. Some vitamins, in particular, have been shown to have a positive effect on the circulatory system. Vitamin B3, niacin. Niacin, also known as vitamin B3, plays an important role in improving blood flow and protecting the heart. Scientific studies have shown that this vitamin can increase HDL, good, cholesterol levels and reduce LDL, bad, cholesterol. It also helps improve the function of the endothelium, the tissue lining the inside of blood vessels, reducing inflammation. However, it should be taken with caution. Niacin supplements can have side effects, so it's always best to get it through your diet. Foods richest in niacin include legumes such as beans, lentils, and chickpeas, whole grains, bran, brown rice, oats, buckwheat, nuts, especially peanuts, and green leafy vegetables such as spinach and kale. Tomatoes and mushrooms are also good sources. Vitamin C. This vitamin is known for its antioxidant properties, but it also plays a key role in peripheral circulation. Vitamin C helps the body better utilize nitric oxide, a molecule that dilates blood vessels, making them more elastic. Several studies have shown that supplementing with it can lower blood pressure and improve vascular function. Despite its benefits, there is still uncertainty about the optimal daily dose, and there is no definitive evidence that systematic supplementation reduces overall cardiovascular risk. Therefore, it is always preferable to consume it through natural sources: citrus fruits, kiwi, peppers, broccoli, and spinach. It is essential to consume fresh foods, as vitamin C is very sensitive and degrades easily. Vitamin K. Often associated only with blood clotting, vitamin K is actually also useful for preventing arterial calcification. Adequate levels can reduce the risk of vascular hardening, although there's little evidence that specific supplements can improve an already compromised condition. The best dietary sources are green leafy vegetables like spinach, kale, and Swiss chard, as well as broccoli and kiwi. However, be careful. Those taking blood-thinning medications should consult their doctor before adjusting their vitamin K intake, as it may interfere with their treatment. Vitamin E. Known as a powerful antioxidant, vitamin E has been studied for its ability to protect blood vessels. It plays a more pronounced role in people with existing cardiovascular problems, such as those with diabetes or hypertension. In healthy subjects, however, the benefits appear to be less pronounced. Foods that are rich in it include almonds, sunflower seeds, avocado, olive oil, and spinach. Conclusions. When your legs and feet send out symptoms like cramps, tingling, discoloration, or dilated veins, don't ignore them. They're often a warning sign of poor circulation, which, if left untreated, can lead to serious complications. It's therefore essential to consult a doctor for an accurate diagnosis. At the same time, lifestyle and diet can do much to improve the situation. A balanced diet rich in the vitamins mentioned helps strengthen vascular walls, keep capillaries elastic, and ensure blood flows with the right fluidity. These are not miracle solutions, but daily habits that, if adopted consistently, can have significant effects over time. Including more fresh vegetables, fruits, legumes, whole grains, and seeds is a concrete step toward promoting circulatory health. It's important to remember that diet is only one aspect of the equation. Regular exercise, hydration, and managing risk factors, such as smoking and excess weight, are also essential. If you're already experiencing symptoms of poor circulation, start paying close attention to your body's signals and don't delay seeing a doctor. In the meantime, include foods that naturally contain vitamins B3, C, K, and E. Your circulatory system will thank you. Please note that this video is for informational purposes only and should not replace medical advice. If you have any questions, please contact your doctor. If you like our videos, please leave a like and subscribe to our channel so you don't miss any upcoming content. See you in the next video.